against measles rubella vaccines. And as a county, we shall be proud to say that we have targeted and we have reached 100% of the population. Thank you very much, Waziri. Karibu sana. Moment and launching this campaign. Remember, the campaign is going to take 10 days. Starting today, 14th of July 2025, we want to give vaccine to our first child of the Kakamega County. Today being the first time we are starting and launching it. Pale kuna wenzangu wahudumu wa afya. Thank you very much. Sasa huyo kwanza ameshafungulia, wengine wote watoto wote wa county wanataka wapate chanjo. Na tunaambiwa kwamba the first one alikuwa boy child. Sasa nataka tupate girl child. Tuseme kwamba typhoid na measles tunaangamiza kwa watoto wote wetu wa pili anapewa, bado tunasema mtoto wa msichana girl child, ili tuhakikishe kwamba kama county tunaweza kuwa na watoto wetu wote wawili na wote wanazuiliwa kupata ugonjwa huu wa homa ya matumbo na measles rubella aka ugonjwa wa ukambi na surua. Asanteni sana. To our MCHs to ensure that all children at 9 months they're able to get typhoid vaccine and they're also able to get measles vaccine the way they normally get it every time. So as we want to urge all residents of this county that for us to ensure that in the future we have a population, we need to ensure that all our children that are eligible for vaccination are reached and are vaccinated. Because as the saying goes, that for the future of any generation depends on the health of the children and the mother. And that's why we are so much sure and so much aware that we need to reach all these children and ensure that they are all vaccinated. So Waziri, I want to thank you and welcome you to this particular launch of today. And members, after the launch, we are going to continue now to start our vaccination.
My name is RCPA Livingston Mbai, doctor. I'm the Minister for Health, County Government of Kakamega. Today we are here this morning to launch vaccination against 2 diseases, that is measles, rubella, and the typhoid vaccine. This is a national campaign that we've just launched in Kakamega County. This campaign is taking place across the entire nation, Kakamega County being one of them. The rubella measles vaccine is going to be administered to children between 9 months and 5 years, and we are targeting slightly above 231,000 children in Kakamega County. And the typhoid vaccine will be administered to children between 9 months and 14 years. And we are also targeting slightly above 800,000 children in Kakamega County. That brings to a total of about 1.1 million children that we are targeting. Now, this exercise is going to be carried out by our healthcare workers, some of them who are here with me, and some have already started doing the work. And we are going to get others across all our facilities as the exercise is going to take place across the county. Some will be stationed in our schools, in our churches, and any other designated place that we are going to consider appropriate as the Ministry of Health. We have already deployed all our vaccinators, the healthcare workers, to those stations to ensure our children have been vaccinated against measles and against typhoid. Now, we also want to take this opportunity really to thank our partners. This exercise is being supported by the National Government Ministry of Health, is supported by UNICEF, is supported by Gavi, is supported by PATH, is supported by World Health Organization, and many other partners that I have not mentioned. We take this chance to really thank them for ensuring that all our children live a healthy life after being vaccinated against these two diseases. Now, you will also recall that we are going to work with stakeholders to ensure that the exercise is successful, and these stakeholders include our teachers in all our schools, include our spiritual leaders in our churches, include our healthcare workers in all our facilities. All of them are going to participate, including our own staff, the medical staff, and staff from those partner organizations that I've mentioned. They are going to be very instrumental in ensuring that, of course, not forgetting the fourth estate, the media, who are also going to cover this exercise and enlighten our people, particularly our parents, to take their children to these respective places for vaccination. So we want to thank all those stakeholders in advance, all our partners in advance, for this gesture that they are going to give us as the Ministry of Health to ensure our children live a healthy life. We also take this opportunity to encourage parents to take advantage of this chance and ensure they avail their children within those category or that range of years that I've mentioned to go for vaccination. Thank you very much, and we hope that this exercise is going to be very successful. I'm praying for good health upon all our healthcare workers, upon all our partners, upon all the media fraternity who will be moving from one point to the other to ensure that the exercise is successful. Actually, when we undertake such a national exercise, you will notice that maybe because of one reason or the other, not all these children that we are targeting may be covered. Because of one reason or the other, maybe the information didn't reach the parent, or maybe the child is feeling unwell, or maybe the child has moved from one location to the other and cannot be able to access this exercise in the next 10 days. So what we are saying is that this exercise will still be on in our health facilities. So even if there will be a child who will miss in this 10 days period, we will encourage such parents to ensure they bring those children to our health facilities so that they can receive the vaccination. Now, on the issue of a child who might have some other complication or who might be under medication and may not be safe to receive this vaccination, our healthcare workers are well trained for this exercise. So before they administer the vaccination, they will have to talk to the parent, and the parent will have to give the history of the child and if the child is under any medication. Then from there, and as per their training, they will be able to determine whether they can continue administering the vaccination or not. So our healthcare workers are very trained. They will ensure they administer this vaccine to children who are supposed to be administered. But other cases that will be unique, they will also take care and they will advise accordingly. A multi-sectoral team, like I've said, and they will be able to offer proper guidance to all our parents. But what we are saying is that the vaccination that we are doing today is not new. It has been there all these years. Even before some of us who are talking today were born, we had the measles vaccine and we had the typhoid vaccine. All of us, as you see us here, we have gone through and we were vaccinated when we were within that age bracket. So I just want to ask parents that there is nothing sinister in this campaign. They do not need to bring in, cultural beliefs. Let them bring their children for vaccination, because they will be helping these children not to be able to contract these diseases that we can prevent now. They may look simple diseases, but once they get into your system, they are likely to take the life of your child, So before we, instead of us waiting until our children land into those health problems, we are just encouraging all parents to bring their children for vaccination. This is not a new vaccination. It has been there since time.
My name is Robert Chisaka, County EPI Logistician, Kakamega County. Today, as we have said earlier, we are beginning our campaign, vaccination campaign exercise that is going to take 10 days, as Waziri has said earlier. And the reason why it's important to have this exercise is to ensure that these diseases that are being targeted in this particular campaign are eliminated or are prevented from our children. We have vaccinated children against measles rubella vaccine and against typhoid disease. And as I've said earlier, the reason why it's important to have the exercise, because as a county and as a Kenya, the nation, we have not achieved the number in which you can say that we are comfortably, all the population that we have has been protected against these preventable diseases. As a county, the year 2024, we had a percentage of 2.9%, and the nationally it was at 83%. And for us to say that our children are protected, we are supposed to be at 95% to 100%. So the reason why you have this campaign is to ensure that we comb our children, we reach all those children who have not been vaccinated, we reach all those children who are eligible between the age of 9 months to 14 years that we are supposed to vaccinate. And once we reach all of them, we shall be sure that these children are prevented against preventable diseases. Remember, these are diseases that are causing high rate of mortality among our children, and are diseases that can be prevented. That's why it's important to prevent our children from them, so that we have a healthy society. So as Kakamega County, we are targeting to reach 100%. We need to reach all eligible children to ensure that they are all immunized and they are all prevented against these diseases you have mentioned. The number of death rate, or rather the mortalities of this particular disease mostly affect our children, that's from below 15 years. And that's why the target of this particular campaign is targeting those particular children. And as we understand, any preventable disease, if it's able to kill even 2 children out of 100, it's a big issue that must be prevented. Like in the last year, we had more than 106 cases that were confirmed through lab that those children had measles disease. And we understand the complications that come with these particular diseases, because once a child has measles disease, the high chance that they can even lead to blindness, and if worse comes to us, that child can succumb. So it's important that whatever the cases that we have that can be preventable, then we must prevent them. And that's why there's need of this particular campaign.
UNICEF, together with partners, is supporting the ministry with logistics, with technical capacity. We are increasing the ministry's capacity to reach all the children in all the sub-counties. In Kakamega in particular, we have provided that support as mentioned, and we will be on ground within the 10 days from today up to 14th of July, providing this particular support to ensure that the county reaches its target of 1.1 million children. And we are looking forward towards a successful campaign as per the details which have been provided by the health authorities in the county. Thank you. As partners, we are actually spread within all the 47 counties in the country, providing specific similar support in all the counties. So if you move around even within the neighboring counties, you will find representation from Perth, representation from Gavi. You will find UNICEF personnel providing this specific support. We have supported polio campaign, we have supported cholera campaign in the targeted counties where outbreaks have happened. But in particular, measles campaign, I think it has been quite a number of years since this has been held. I think the last one was around 9 or 10 years ago. But most of these campaigns are held within counties where there is specific outbreak. So for Kakamega County, I don't think we have had the incidences that have required large widespread campaign. So this one in particular, I think it's been quite a while since we have had it.
My name is Ezekiel Mpapale. I'm a resident of Kakamega County. Brought here my daughter, Joy, who has just received the vaccination for typhoid. And I think this is a very good initiative for both our county and our country. It's safe for our children to have this vaccination. I really want to encourage my fellow parents that it's very safe. We have read about it, and indeed it's something that is going to...
My name is Sarah Bwire. I brought my 2 children here for vaccination. I feel that the vaccination is safe, and I will ask other parents to allow their children to be vaccinated against these diseases.